Good evening, ladies and gentlemen, and welcome back to Islandish podcast right here on the Superior Talk Network. I am your host, Yams, and it is a pleasure to have you with us this evening. Tonight, we have with us none other than Dr. Kelafo Collie. He is the CEO and Chief of Staff of Ralph Health Center, and it is a pleasure to have you here. How are you doing this evening?
Wonderful. Thank you again for
Yes.
having me. Pleasure to see you, and you look well. And
Thank you. Thank you.
for
So
this
do you.
opportunity. Thank you very much.
Awesome, awesome.
Yes.
So you are, in my opinion, one of the persons who basically is leading the way when it comes to not just health awareness, but also standing in the gap for those of our community who really have those needed necessities, who have those health concerns, and really want to feel like family when
Yes.
they come to the health services. So talk more about your health services that you provide here in Grand Bahama and a little about your journey and education.
Yeah. Well, thank you for again for having me. I've been in Grand Bahama from 2008.
Mm-hmm.
Yeah. So, 7 actually.
Okay.
2007, and so we are part of Kelafo Collie Company Limited, or Rafa Health Center.
Mm-hmm.
We're a primary care and family medical center that caters to the children, to the adults and elderly. So from the cradle to the grave, we say.
Yes, yes,
right?
yes, yes.
And everything in between, of course, and providing all of the essential services. Seeing children, immunizations, and treating whatever common medical conditions.
Mm-hmm.
Do some surgical procedures and some other interventional procedures, and yeah. But we have a family-centered
Mm-hmm.
practice. We believe in connecting with our clients and customers and patients and walking with them through
Do the whole thing.
the whole process. Even if we refer to other specialists for specialist care, we're still a part of that
Mm-hmm.
service, and we like to follow up and see them back afterwards and keep that continuation of care.
Yes.
That's what family practice and primary care is. Also did 10 years of neuropsychiatry at the Rand Memorial Hospital.
Okay.
Yeah, and ended that about 5 years ago,
Okay.
and went back into primary care, and I've done some family medicine training and emergency medicine training, and yeah, that's where we're at this time.
Wonderful, wonderful.
Yes.
So talk more about your health center, the amount of persons you have on staff, and some of the key
Yeah.
services in the community that persons need to know that you guys provide.
Yeah. So again, from the cradle to the grave, we have a wonderful team at the facility. Some in the forefront and some behind the scene.
Yes.
All right. So we have office CEO Shaleba Collie, my wife,
Yes.
of course, who's watching, and shout out to her and the crew and the family there. And then, of course, we have other persons who, office managers, medical staff,
Right.
nursing staff, accounting team, financial teams, a whole list of people who make it happen.
Right.
Make it happen on a daily basis, down to the housekeeping person. So we have a team. If they don't keep the floors clean and disinfect,
Then
we don't
it's
have
a
a proper
problem.
center.
Right.
So from that person, few people who do that, all the way up to seeing the practitioner, we have a wonderful team of people who are working every day.
Wonderful, wonderful.
Yes.
So when it comes to health concerns here in the
Yes.
Bahamas, a lot of persons, for whatever reason, I am not sure, feel that the health services here in the Bahamas are quite lacking. What would your response be to that when it comes to just not just general health care, but also, like you mentioned, those specialty needs?
Yes, you're right. You're right. We have a country that is growing and has grown from 1973 to now.
Correct, yes.
And we still have a lot of specialists that are needed. So almost every young person who has that interest in science, I try to persuade them to go into medicine
Right,
and to specialize and come home.
right.
Because we have tons of doctors in Canada, in the U.S., and even as far as Australia
Yes, oh wow.
and the U.K. We had tons of doctors who went to the UK a few years ago. I think about 10 of them in total who just left and went. And then we have a drain with nurses who have left as well. And so we do have a tight service. So there's a challenge with that. And then we're Nassau centric.
Yes.
Most of the practitioners are very good at what they're doing. Most of them stay in Nassau. And they only come and maybe visit the other family islands, which isn't the best. We need top specialists on every island.
Correct.
But of course, there has to be opportunity. It has to be the facilities. Some other things that need to be done. The people. So most people have to travel from the family island into New Providence, the town, they call it, to get care. Even here in Grand Bahama, a lot of services are still not available here as yet. And so we're working on that. All of us, the government and private practitioners see the need and are working very hard to try and convince, encourage, and sustain those who come in staying. So we have a way to go. The good news is we have, programs where in the University of the West Indies where doctors are coming home and almost on a yearly basis. The UWI program, programs in the Caribbean Offshore Medical School, the U.S., they're coming home and they're graduating 30 to 40 doctors.
Wow, yes.
We have to keep them.
Yes.
And then they have specialization programs. You can specialize there and other options. So it's growing, but we need more.
Definitely.
We need more. Yes.
Definitely. Would you say that salary and income is one of the reasons why a lot of persons leave? Or is it the facilities? What do you believe is the main cause of the brain drain in the medical field? Exactly.
Brain drain is a common thing. And it happens worldwide, not only here.
Yes, definitely.
I like the Bahamas. I like home. I think there's a great opportunity. Some of the nurses would say better opportunities, I guess, to further their studies. Because when you compare the salaries, it's always the same. And I know some practitioners, doctors, specialists who came home because they were the first on the market. They were the only one in that specialty in the country. So that's a huge thing. So when you go to the U.S. and Canada and UK, you could have up to 50% taxes.
Right, correct.
So when you work out the taxes that are taken out overseas, the living costs, being away from home, being away from this beautiful weather, family, friends, and then the opportunity to give back and you're the top in your field in your country, top specialists. Those are the issues people look at. And it's still down the line. Some people say finances. Some people say they could study more and move up the corporate ladder quicker in the United States or Canada. Some people are young and they want a faster paced life. They think about coming home later on. But right now, they love this big city life.
Right,
the New York, the Chicagos, the Miami, the Los Angeles,
Atlanta,
Texas, where a lot of Bahamians, Atlanta, where young professionals are, and they feel they want that life for now. And then later on, they might come back home when it's slower pace. So there are a number of factors. But in any event, we need to encourage better incentives for our people to come home.
Correct,
and to stay home.
Right.
And some of them say facilities.
Right, that's true.
Some say the attitude. Some say the red tape to do things, to get established and to grow. Some say it's just not enough staffing, not enough instrument, equipment, whatever the factors, not enough money, a number of factors. And hopefully we address all of those because we want our people staying home.
Yes.
And building the country over the next 50 years at least, building the country strongly and bringing that insight and training and education they have back to the country, you know?
Definitely. I like the direction the conversation is going in. As you can see, I'm asking you some really broad opinion questions before we focus in on what exactly Ralph Health Center offers to the community. So my last broader question would be, of course, talking more about NHI.
Yes.
Is that something your center accepts? And can you explain a little bit more to persons who don't understand how NHI works?
Absolutely. No, I love the questions because, this is what we hear about. And I try to think holistically. But yes, to answer your first question, I am a part of NHI. I've been with NHI, which is National Health Insurance, shortened form NHI. It's not the same as NIB.
Correct.
That some people um, made mistakes at the beginning, mistook it, but now they understand a little clearer. But it's still ongoing education.
Right.
So National Health Insurance is a wonderful initiative, great initiative. The government established, I think, about 9 years ago. And what it is a program. In fact, the World Health Organization and most of the major countries are pushing to get NHI.
Yes.
So it's a global initiative to try to provide access to health care for the general public, in fact,
Right.
almost all your population.
Right.
In particular, primary care, so people can walk in any day, anytime, giving them access, giving them opportunity, giving patients free point of care. Okay, so they don't have to pay at the point of care, and creating a home center. So each clinic is a home center for the clients.
Okay.
Okay, that they can have access to and a continuation of care throughout their lifetime. And so that's what the government did, and the numbers are very good now. At the beginning, it took off, then it slowed down. It's not a political thing. It's a national initiative that the world, and I want to congratulate the Bahamas because it became one of the few countries in the world that has implemented it over the last few years.
Right.
And so patients come to the office and get free care. All they have to do is call into NHI. They had an office here, but now in Nassau. Give them your NIB number. If you're a Bahamian, a resident, any age, any pre-existing condition, it doesn't matter. No paying at registration, no paying seeing the doctor, and you can see the doctor any day, anytime during those hours without paying, okay? And the government subsidizes the healthcare providers for that.
Okay.
Yes.
Wonderful. Do you see a lot of Grand Bahamians coming in using NHI? Has there been an uptick recently? And what do you think has been the cause of that?
Yes, it's been an uptick. At the beginning, it was moving well. Sadly, when these initiatives take off, people try to make it political. So it was at a time right before the election it was launched, and at that time that party didn't go back into power, but it was a national initiative.
Right.
So of course the subsequent government did not promote it and push it as it should have been, and then that government lost, and the government that started it pushed it again to let people know it's not something political. This is real, it's working, it's active. And to this point, I think there are over 100 doctors now registered,
Yes.
which is good throughout the country. And I think about 200,000 Bahamians. That's just half the population, right?
Right.
So others still haven't joined on. But that's fine because some people have private insurances.
Correct.
Some people like paying cash.
Correct. That's true
And
too.
some people have whatever reason. But it's a very simple process. NHI has been very active in helping the providers walk along the way and try to reach clients who have been seen, those who haven't been seen, to try to reach them. Sometimes they do it from the headquarters. Sometimes they work with us in encouraging persons who have registered to come in, be seen, do your annual physical, do your blood works, get your mammogram done, get your pap smear done, have the children immunized, men have your prostate. They work with us to encourage the patients to come out. And there were some drives over the last year that got a lot of people who had registered and had forgotten that they had registered, or who didn't know. And so we were working with the headquarters to just reach out to them to see if patients were still here or overseas or they relocated, and to encourage them that, hey, you're active, you're alive, come and use it.
Okay, wonderful.
So we have seen a lot of Grand Bahamians use it.
Okay.
And once the word spreads, people are using it more frequently.
Great,
Yes.
great,
Yeah.
wonderful. Before we take our commercial break, I have
Yes.
one more question I do want to ask you.
Yes.
And that question has to do with the difference between, well, not really the difference. So before I get into that, most of our viewing audience is between the ages of from 18, I'd say, to about late 40s.
Yes.
Around that age bracket, would you recommend annual physicals? If so, what are some things that those persons around that age bracket should be looking out for or focusing on?
Very good questions. You have some great questions.
Thank you. I'm
And
prepared.
You're prepared. And you don't even have a script here,
No
right?
paper.
This is live, guys. So you're absolutely right. The best treatment, I would say, is prevention.
Okay, yes.
So most of the diseases that we see, like colon cancer, breast cancer, stomach cancer, cardiovascular diseases like a heart attack, strokes, high cholesterol, sugar diabetes, begin in that age.
Okay.
Even earlier. But at 18, young persons, they think, oh, I'm fine. I don't have to get checked. But no, we look at the gentleman, Bossman, who acted as the star role.
Yeah, Chad Boseman. Black Panther.
The main feature star. He was just 40.
Yes.
A little over 40 when he died from colon cancer. And he had it for a few years. Who would have thought? But, young, healthy star. But again, now we're seeing in our country, young women coming in their 30s, late 20s with breast cancer, even younger. We have patients who are in their 20s who are diabetics and hypertensives. And I was talking with a young man today who had a stroke and has a pacemaker, a young man. I said, wow. Not a patient, just a guy met, we were talking. But so these are the things you want to check early. And of course, that age group, there's so many things. We talk about cervical cancer, so you want to do pap smears and talk about the HPV vaccination in young women so they don't develop cancer of the cervix, And then, of course, that age group, STD. Everyone who comes, I ask them about STDs, STD treatment, STD testing and screening, and contraception, of course, for young men and women. All forms, talking about men and young women, and those type of things. Sexual health, sexual wellness, STDs, and then doing your colon cancer screen, and all your cancer screens and all your tests. So yes, come on out and do your blood works, do your checks, your screens. If anything needs to be or can be prevented, if we detect it early,
that's the
earlier,
first step.
the better. Yes, first step.
Definitely.
To wellness.
Thank you so much. Sure. So we're going to take a quick commercial break, and then when we come back, we're going to talk more with Dr. Collie about the importance of health here in the Bahamas.
Hi everybody, I'm Jason.
And I'm Cheryl. Join us here on Superior Talk Bahamas YouTube channel every Tuesday at 6 for Let's Talk,
where we talk about issues that matter to you. We try to come up with workable, practical solutions so we have more action and less talk.
See you on Tuesday.
And we are back with Islandish Podcast, talking with Miss Dr. Collie. But make sure you are subscribing to the Superior Talk channel. Hit the subscription button below. Also, share the link with your family and friends so they could join in on this amazing conversation. Leave your comments down below. I'll make sure that Dr. Collie sees them after the show. Now, Dr. Collie, before the break, we were talking about the importance of screening and prevention when it comes to younger persons between the ages of 18 to 40. And with that being said, you also mentioned a lot about breast cancer and colon cancer and how they are now developing at a younger age. What do you think are some of the factors that are now contributing to that in our generation right now?
Absolutely. There are two factors. One, the scientific and medical community is saying that we are probably seeing more cases because we are doing better screening.
Okay.
So 50 years ago, we didn't have the screening tools, the tests, and the education and promotion to do that.
Understood.
So we are screening more people. More women are doing mammograms. More women are doing ultrasounds of their breasts. There are more support groups out there. There are more cancer groups and support groups out there.
Yes.
And women are going out in larger amounts. And out of those amounts, you're seeing more results and detecting cancer earlier. So the numbers are better in that aspect. Now, what is the root cause of these cancer forming? There are a number of factors. You always look at one, genetics.
Okay, yes.
You want to get checked if you have a first degree relative. Of course, we had some families in our community
Yes.
who 3, 4 sisters died.
Yeah.
And many like that because it's just in the gene, sadly. That family and those family had, and young women, but the sisters, the mother, the aunt of the father, any first degree relative, had that gene for breast cancer. And sadly, when it was time, that gene turned on like a light. So genetic factor is the cause of so many issues with breast cancer development. Secondly, you talk about environmental factors.
Right.
So, of course, our eating habit. They believe in industrial worlds, industrialized cities, you're going to have the exposure to pollution, toxic gases. That's the price of development.
Right.
And when these industries come in, what happens? In fact, we had a few universities come here and study in the eastern part of our city where you have industrial areas.
Yes.
The rate of breast cancer was much higher with women in
Understood.
those areas. And they believe that to be related to the exposure to the fumes, which most people can smell, and those chemicals possibly seeping into the water, into the soil, into the air, and those women are, and their children now have a greater risk. That's documented. University of Miami came here and saw that the women have this gene BRCA123, which is just a breast cancer gene. It's highest in that area, and by extension, some of the highest in the world.
Wow.
Yeah. So environmental factors. Now, environmental also includes lifestyle. You know,
Yes.
not getting out there and eating healthy fruits and foods that are nutritious, organic foods. You have a lot of foods and meats that are filled with pesticides.
Right.
Not getting that exercise, that sunlight, the high amounts of stressful environments people are living in also causes that. Just a sedentary lifestyle, not getting up, not moving. Then, of course, lack of medical screening.
Okay.
Like not going, there's some women I talked to today, not actually today, but in our time, who still haven't had a mammogram,
Wow.
who still haven't done a breast ultrasound, who haven't had their pap smear in 10 years. And like, why you haven't done that? It's available. We're talking about it. Just too busy. Or they don't have the finances. They feel they don't have the time. They're busy taking care of family and home and have a professional life.
It's
So again,
fair factor as well.
absolutely fair. Fear of the unknown. Fear of going to that doctor and finding out, yeah, you have breast cancer.
Right.
And at what stage? And what do I do? And I don't have enough money. And I might as well keep this to myself because it's going to be a burden on my family to pay for the doctor fees. What if I need chemotherapy? What if I need to have my breast removed? Am I still a woman? My femininity. Will my husband still love me if both of my breasts are amputated? Will I still be a woman? Will I still be sexy? You know, will I still be useful?
Right.
And for men, the same thing. Hey, if I have this disorder, if I have prostate cancer, colon cancer, or I have a heart disease, is it easier for me or lung cancer, just to die versus to, put the burden financially on family, friends, loved ones, to go through chemotherapy, through radiation, losing my job, losing my resources.
Freedom, mobility, yeah, all of those things.
Absolutely. So
Right.
fair. You're right. It's a big factor. So we encourage people to buddy up.
Yeah.
Get a few people and few women go and go together. A few men go and have your prostate checked together. Go and do your annual together as a family, maybe on your birthday, or with some buddies from church or some men's group or some brothers or friends. Just go together.
Yes.
So if there is an issue, you have that support group to walk you through.
Definitely,
Yes.
definitely. Because a lot of times, and I'm happy that we touched on it earlier, and I asked the question about that 18 to 40 age bracket
Yes.
because the persons you see to the hospital are usually the ones who are already sick or much older already, and they
Yes.
always to the hospital. Like, yeah, I'm going to the hospital. Come take me to the hospital. I need a
Yes.
ride to the hospital because they're always checking
Yes.
because they're at that age. But
Yes.
you're saying now that prevention is the most important thing.
Absolutely. Prevention is better than cure. Some
Definitely.
People say. So if you can know and not be afraid to know, just find a comfortable provider that you can go to and who can talk and talk about anything and not be feel like you're being judged or criticized or looked down upon. That's important. Someone who's you could really open up your life and not be ashamed
Right,
to
right.
talk about anything, any little itch, any little bump, any little growth that you might think is insignificant.
Right.
Say, man, doc, man, I have this itch in this area, and you feel comfortable saying that.
Right.
And they could check and monitor things, and ease of access, someone you could get to right away. That's a factor too. People don't want to wait 5-6 hours. They want to come in, be seen,
And
be
go.
treated, go and move on. Especially when you're young and trying to
Yes.
maybe
I
like
got things
have
to
time,
do.
5 hours in a clinic or facility. You have things to do.
Yes.
You want your results right away, and that's understandable. That's understandable. You're busy, you're active, and life is moving, and it should be available for you to just get in, get results, get treatment, get a screening, and know you're good for 6 months to a year.
Right.
And it's confidential, of course.
That's
you don't want
what's
nobody
gonna be
know,
my
but,
next question.
if you have, HIV, no problem. There's treatment. You could see your provider, and that's confidential. You have cancer, that's confidential. If you have an infectious disease, whatever type, that's confidential. Whatever the case it is, you and your provider have a relationship. It's confidential. That if they see you in the store, they turn their head the other way. And if you hail, and you hail, and that's it.
That was
And
going to
that
be
finishes
my
it.
next question because I feel like, especially in my age bracket, a lot of young people, especially in Grand Bahama,
Yes.
we feel like the community is so small and I
Yes.
know these people. I don't want them knowing my business.
True.
So my true question would be, as it relates to confidentiality and the law, what can you share or educate some Bahamians on as it relates to their medical history and what legal actions they can take should
Oh, my goodness.
confidentiality be breached?
Oh my goodness. Yeah. Well, first of all, it's law. In the U.S., it's called a HIPAA law. In the Bahamas, we subscribe to the same concept, privacy of medical information.
Okay.
Of course, that's something we stress in our practice, and we work with NHI, and that's highly stressed. Full confidentiality. In fact, from the minute people come in, from workers to cleaners, that's something they sign
Right.
and agree to. You could be terminated immediately, and you could be charged. And we go over that all the time. Of course, the provider, that's an oath we take to complete privacy, confidentiality of everything. That's from what is discussed in person, on the phone, what is written down, what is
Right.
documented,
Medication.
everything has to be locked away and guarded, from the medical files, the electronic medical records, to something you said in passing. Okay, and so that is paramount. It's no getting around it.
Right.
Okay, and of course, if any breaches happens, oh my goodness, that's a whole medical legal problem, because it goes to, from the medical council, which all doctors who are registered in the Bahamas every year have to renew that license and subscribe to confidentiality, and to, if they were charged with any criminal offense or have any legal matters pending,
Right.
you wouldn't get your license in the Bahamas
Okay.
if you do that. Then, if you're before the courts, oh my goodness, your license is at stake, because you're not supposed to share any detail. If you see your mother, you can't tell your mother anything. If your mother, well, you shouldn't see your mother as a client,
Right.
first of all. But if I always tell my staff, if you see your cousin, your auntie, your sister, your friend, or your ex, or your current, leave the room because,
Right.
if you feel it's too close and you might divulge or might be uncomfortable, then you have to leave the room. Notify me right away.
Right.
So you don't come in the room, or if your relative is there, I ask you to step out. We have a small community. I ask staff to step out, step away, and not be involved with that client. And of course, always reminding people it's a legal thing. You can be arrested.
Yes.
You can be put before the courts, and you could go to jail for that any type of breach.
Just for running your mouth.
Running your mouth is a very serious thing. Talking fool.
Right, right.
So it's, you can't do that. You can't do that. Even to the file being not left around.
Right.
Or even if, oh my goodness, it goes far. Phone conversation, prescription. It goes to even documents, having them securely locked away in your office and filed away properly is all a part of that. Yeah.
Thank you so much. So we're going to take our next commercial break, and then when we come back, we're going to talk more with Dr. Collie and about his expansion as it relates to Ralph Health Center.
Yo, what's up, Bahamas? My name is Andrew Williams, aka Cat.
And I'm your boy Mix.
And we're representing Off the Bench, the #1 talk sportcast in the Bahamas.
In the world, my boy.
My bad partner. So we cover anything sports throughout the Bahamas. We cover our Bahamian athletes wherever they are, and they're making waves in sports. We cover them.
Hey, just tune in to us every Wednesday here on Superior Talk at 6:00 p.m.
The #1 talk show
in the world.
In the world, Craig.
Yes, we are here at Islandish Podcast right here on Superior Talk, talking with Dr. Collie about the importance of health in the Bahamas and about his amazing practice at Ralph Health Center. Now, let's talk about your amazing practice and about not just what you're doing or what you're planning to do in the very near future.
Yeah. Well, we see ourselves as part of the community. We love being here. We love Grand Bahama. I love Grand Bahama and the people here. I love the Bahamas. I love my people. So I want to just continue to pour into them. And I love family practice because you don't only just treat medically, but you get time to know people.
Right.
Build relationship, and we talk about everything. Sometimes people come in there with, issues going on with them and their family, and we could bring their families together, their spouses together, their children, their home. And it's a holistic approach I've taken to working with my community because I want to see everyone succeed.
Right.
So it's a holistic approach. We're a holistic mind, body, soul, spirit concept. We try to cater to the whole person and making them whole. We are healing. I see ourselves as a healing practice.
Yes.
And people come there, tell the staff, and they know, and everyone is aware. When they come in there, that's where the healing starts. How we treat them, how we love them, how we thank them, how we're grateful that we are being honored that they can come to us. They can go anywhere. And sometimes we send them other places.
Right.
Because we are part of a global community. Some of my colleagues here, I send them out as needed and even to the hospital. And we still work together. And that's how I see it. People might have a different view, but I see myself as part of the bigger solution, being a part of the healthcare family in the country, and using all the facilities. Facilities I have to use, our families have to use.
Right.
So we might as well make it great.
Yes.
Make every aspect of it great. And the doctors here are working really hard and doing well, my colleagues and all throughout the country. Good people. Healthcare providers are generally good people.
Yeah.
They went into this field really to help people and touch lives and make a difference. And I try to keep that motto, keep that mantra, to make a difference, touch lives at first cause. First, do no harm.
Yes.
Yes, do no harm and do good to all humanity. So that's what we're doing, and that's what we're a part of, a healing center.
Yes.
Yes.
Yes. So what expansion projects do you have in the winds?
Yeah, we are excited about just growing in Grand Bahama. We have a few things on the table to offer more services here, like screening and testing and other procedures we want to be doing. You listen out, stay tuned. We want to offer a whole lot of things in Grand Bahama coming soon. And a holistic, like I said, holistic approach to healthy living. Right now, a lot of screenings and colon cancer screening, STD screenings. We're bringing some new initiatives here. We also have some weight management
Yes.
programs.
I wanted to get into that next.
And whether it's exercise, diet, nutrition, medication, and we're seeing great success in that. Reversing diseases, bringing new disease treatment modalities, getting people on healthy living, nutritional foods. And then we have some other things. We're going to be back on the show. We're gonna be
Definitely.
more about that. We have some wonderful people with us, and they're going to be joining us to bring a holistic, full care to our city very, very, very soon. By God's grace, we'll talk more about that later on. We'll be back here. Hopefully
Definitely.
You'll have us.
Of course.
Yeah,
You're
but
always
we-
welcome to come.
Thank you.
And
But
we'll
we
talk
love what
more
we do.
about that
Yes,
later in the
yes,
year
yes,
as
we-
that advances.
Yes, because we want to make our mark here, and we love the people here. Yes.
Definitely. So what I want to talk about as we start to wrap it up is more things that is happening recently in
Yes.
health. So as it relates to, I can't call it people calling it the upgraded COVID.
Oh,
And this so-called super flu that people have going around and things like that. Some persons, of course, there are those who do not believe in the vaccine, persons who do believe in the vaccine, persons who feel like COVID or the flu is now becoming more rampant and we need to go back to COVID protocols. What's your view on those situations or those stereotypes?
very good. Excellent question. All questions, but these are very good questions. And it's real. It's happening. I am seeing an uptick in persons with flu-like symptoms, And, of course, we call everything flu. But it could be influenza. It could be another type of viral illness. And it's definitely people are coming in with respiratory-like illnesses. Some with nausea, vomiting, diarrhea. And for us personally and me, I have put in the protocol.
Right.
Reactivated gloves, masks, safety protocols. Persons coming in requiring masks, sterilizing. And of course, sometimes wearing my mask even when I go in the public. Yeah, this is the influenza season. And it might be a new strain. It might be COVID. In fact, there's still some COVID positive testing that has taken place. And or is this a new strain of COVID, or is this something new from what they have announced from Asia that's on the rise now? So we have to be cautious. And of course, I've spoken to a lot of patients who, some are teachers and their classes are out. Kids are home by the
True.
significant amount. So it's time. I think it's important to activate some type of policy, protocol. Even if, as simple as if your child is sick, let them stay home.
Right, yes.
Have them home. Washing hands again. Taking sanitizers again. Or antiseptic wipes. In fact, I never stopped at having a big bottle at home and in the car. Just taking off your shoes again, If you're sick, husbands or wife, I had to tell some husband wives, go in the other room, isolate. So if you're sick, even as simple as isolating,
Right.
will help out the family. Wiping down the doorknobs and handles, changing your toothbrush. Some people don't even think, hey, had the flu and now I'm over it and I'm still using the same toothbrush.
That's true.
Simple as throwing away the toothbrush.
Yes.
Simple as wiping down the handles of your door,
Changing
spraying,
sheets.
changing sheets, changing the blankets, the towels. Bleaching those clothes or disinfecting those clothes you had worn. Opening the windows,
That's true.
going outside, letting the fresh air flow through, putting the windows down if you're in the car. All of these things help to prevent the spread If you're sick, don't go to the food store.
Yeah.
You're coughing and sneezing all in the air. You're infecting everyone. Or at work, stay home. Take the 2-3 days off. The work is not going to fire you if
Right.
you have that condition. So again, we should beef up the precaution, beef up the protective measures,
Right.
and be cautious. And let's see what happens. Hopefully the numbers go down. But if this is another, God forbid, epidemic or pandemic, we are ready. So again, I tell clients, stock up the immune
Yes.
boosting drugs, getting that vitamin C. Some people are elderberry, even as good as some of your bush. Getting your vitamin C's and your multivitamin, walking, exercising, getting the fresh air, sunlight, staying cautious, going back to bumping.
Yes. Yes. Elbow.
You're
Right.
shaking hands and using the same trolley, you're sneezing. I mean, these are how viruses are spread normally.
Right.
And this is the season for it, every year during this time. So we might have a combination of all those viruses, or they might have mutated. We don't know yet. But yes, take precaution. Protect you and your family.
Right.
And let's see how the season goes.
Definitely.
Hopefully it's a safe one. It's not a bumpy one like the years prior. COVID put a beating
dent
on the world, and the world is still recovering. So medically, we've gotten gowns and masks and gloves and everything lined up and ready. If we have another outbreak,
Got
it's
it.
very possible. Yes.
Okay, so at the beginning you talked about neuropsychiatry.
Yes.
So as we start to wrap up, we're going to touch a little bit on that as well. So as it relates to that, what kind of practice, or explain to my listening audience, what exactly kind of work you've done in the Bahamas as it relates to that?
Yeah. Okay. So neuropsychiatry deals with neurological diseases and mental illnesses, and that's because, I did 10 years in that department at the hospital, and I've continued that. So this is a total of 17 years
Wow.
doing it. Not as much because I'm, outside, but in the hospital we were responsible for neurology, which deals with the brain and brain
Right.
illnesses. So here's the thing. Sometimes people present with strange behavior or erratic behavior, aggressive behavior, and we automatically think, hey, they're tripping out. And so our job was to go in and to make sure this person wasn't having a stroke.
Right.
Make sure they weren't intoxicated with a substance. Make sure they weren't having a heart attack or tumor. Sometimes people thought that, and when we came and investigated, did a CT scan and imaging or look at their blood works, we found people who had tumors, brain tumors,
Wow.
or meningitis infection, or had their kidneys failing, or had a bleed to the brain. So we make sure rule out those life-threatening conditions with the medical team, and once that person is found not to have had any one of those medical causing conditions, then we go ahead and treat for active psychosis. And that psychosis meaning being violent, aggressive, hallucinating, having delusions. And most of those cases in the Bahamas were substance abuse.
Okay.
So people who are cocaine, people who are marijuana, LSD, PCP, we've seen all of it. Substance abuse, all types, came in through the emergency room, very aggressive, violent, and we had to manage them, treat them, admit them, stabilize them, with the aggression, the hallucination, whatever state they came in. And when they came off that active psychosis or psychotic episode, and we dealt with, if it's toxin, like substance abuse, working with them.
Okay.
Try to get them off that substance. So that's neuropsychiatry. Outside of that, if patients didn't come in aggressive through the emergency room or in the outlying clinics, if they came in with suicidal thoughts or attempts, we dealt with that. If they had an underlying mental illness, like a psychotic thing like schizophrenia, bipolar, if they came in with depression. I've treated patients with eating disorders, learning disorders, adolescents who've had behavioral issues, relational issues, all of them, fear, phobias, people who had OCD, people who've had all type of mental, the whole scope of mental illnesses, we would call them, eh?
Yes.
Yeah.
So you mentioned cannabis, and I wanted to know, as we start to wrap up, your opinion on the cannabis bill, quote unquote, or the need for medical marijuana, as a lot of persons are trying to push for it. What's your view on that as someone who practices in the medical field?
Very, very provocative question. Well, it's two things, really. And I wish that we had more persons giving input into what's happening. Number one, the active, open use of cannabis as recreation, I'm totally against personally, because I've seen it destroy too many lives.
Right.
I had to admit too many young people on the ward early in the day, late in the night, early in the morning, psychotic, who threatened families, who were attacking loved ones, whose families' hopes are being shattered because their good young son and daughters now walking the street because they're marijuana addict. They're chronic cannabis users. They're chronic cocaine users. These are gateway drugs. They start with alcohol and then weed, and then they go to cocaine, and they go to heroin, and they go most of the times. Not all the times here in the country if it's not available, but that's how it progresses. I'm against that because I've seen too mmany lives destroyed. I could never accept that. Personally, professionally, and even faith-based as a believer. I could never condone and encourage someone recreationally smoking. However, studies have shown that CBD, the component found in hemp, and small amounts found in cannabis, have been beneficial in a lot of cancer care.
Okay.
But that doesn't mean you have to smoke it.
Right.
If they're going to take cannabis, grow it in a regulated form, have scientists take it and extract the CBD, which is different from the THC.
Right.
THC is the component that causes persons to get high.
Yes, that
and
feeling.
psychotic and delusional, and it's damaging to the brain of an adolescent brain. Under 21, they said over 21, it's not as deadly, but it can still cause psychosis at any time.
Right.
CBD, 1, 2, 3, a few subsets found in cannabis, low amounts. Hemp is the cousin of cannabis.
Right.
And CBD is found in great amounts in hemp. You grow hemp.
Yes. Hemp is completely different from marijuana.
Different, and has small amounts of THC,
Right.
which they will take the bulk of the CBD and make tons of helpful cancer-fighting nausea medication. People who have nausea and vomiting, people who have PTSD, who came from wars, people who have had trauma, people who can't sleep, people who have nervous conditions, people who've had all types of cancers. The studies show that CBD helps calm the nerves, manages pain, can be used just like cocaine. Cocaine was originally and still is used in some countries as a local anesthesia.
Right.
For pain management.
Yeah, like for dentistry sometimes as well. I've heard that. Yes.
Exactly. So lidocaine, bupivacaine, cocaine, all of these are the cousins. They're used for pain blocking in anesthesia. So cannabis is the same thing. CBD can be used in a controlled environment to deal with these hosts of diseases. So anyone who's a scientist who want to grow it and have scientists who will extract it and make it into medical forms, the CBD, take out that, make it into creams and gels and capsules and rubs and teas. And then the hemp itself, the fiber, all the scientists, all the fellows on the street knows that you can make thousands of products from cloth to rope to building material to rugs to textile to industrial products from the hemp, it will be a thriving industry.
Right.
But we got to make sure it doesn't get on the street and just further destroy our country.
Right.
Because the young man with marijuana that free is going to be a big problem.
Yes.
Be a big problem. And who gets it? Who gets the license?
Who gets to use it?
Who gets to use it? And who gets to sell it? And if I'm a Bahamian, how do you not? Who's going to make these decisions on it?
Right.
And who's regulating it? But I hope it's a great industry, and I hope that we look more into hemp and CBD and have a set of doctors and researchers and scientists who will properly make it into medicinal forms and allow it to. We could be a hub for medical use,
Right.
medical treatment, stem cell, and new types of treatment modalities. People could travel from the world to come here, not just to smoke it, no, just to get, it in capsule forms, tea forms, and use it and see results. It will produce a new industry for the country that would be really, really good without all of the backlash.
Right.
If it gets on the streets and
The social
destroys
problems.
The social problems.
That'll come
the
with it.
addiction, the filling up of the mental institutions,
Right.
filling up of prisons, the
Gang-related
gang-related
activity.
wars, and the trade to get that to America where it's going to be worth 10 times the amount. The trafficking. Oh, my goodness. We
It's a
gotta be
slippery
cautious.
slope. It's
It
a
is.
thin line. It's almost like walking on a razor's edge.
Yeah.
With dealing with it.
But they have to say CBD,
Mm-hmm.
hemp, have the university and the doctors and scientists develop it, and we encapsulate it, government run, or if you have a farm, you run it in a state area and we come and collect it and we process it.
Yes, that makes perfect sense.
Then, but you have religious use. What you can say to Rastaman, he want to smoke it for his religious use.
That's
It's
true
a
as well.
slippery thing. Then everyone would be, hey, you can't
Nah,
tell
I
me
want to
I'm
be
not a
Rasta.
Rasta either,
Yeah, that's true.
because my head bald. I'm not, but how can you say from the outside if someone is a Rasta or not?
Right.
How can
You can't
deny them their
regulate
right?
faith.
No, you can't regulate faith.
Right.
I'd be a Rasta today and something tomorrow. But, if I use it as my sacrament, how can you determine that? So there's a lot of things they have to properly regulate and put in law and in policy and get wide consultation. But it's already going to be launched, so we pray.
That's all we could do at this
Yes.
point. Yes. But this has been an amazing conversation. I loved it so far, and we're definitely going to do this again.
Thank you.
But if persons want to reach out to you in your practice or
Yeah.
visit your current location, let them know more about how they can get in contact with you.
Oh, well, Google.
There's that.
Google, and we'll be happy to see you. But those who are watching, Rafa Health Center, you could Google it, or 352-2130, where we provide, and also I personally do some life coaching, which is outside of medicine. So if you're looking to develop your life for this year, we're here to help you with that, Shalewa and I, to develop your life. And so those are the numbers. And I also let people call me on WhatsApp if I can help with anything.
Right.
And it's not only medical related. I'm here to be an outreach to the community. So 727-9990. 727-9990. If you want to send me a WhatsApp, ask me a question from today about what you need, I'll respond to you as soon as I can. And we'll be happy to talk with you that way. Or the office number 352-2130. And we're in the number, where is this? Piper Manor Plaza. Number
Yeah,
one,
he
Piper
next
Manor
to
Center.
Print Masters.
Print Masters.
That's the
where they
best
used
way
be,
to say.
yeah. Or
And where Paint Fair, right.
Used to be.
Yes.
Next there, that's East Mall Drive, is it?
Yes.
East Mall Drive. But we'll be happy to see you. If you see me in the store or around, ask me and we'll talk, and I'll be happy. I like educating our community. So if you stop me or want to send me a shout out or call, I'll be happy to talk with you about anything.
Yes.
My wife doesn't mind.
Yes, yes. Man, it's been an amazing conversation. Thank you so much for stopping into Islandish podcast this evening.
Yes.
How was it?
It was amazing. Thank
Yes.
you. It's beautiful setup, and you're doing a great job. And I've watched some of your shows, and you've had some of the top voices in almost all
Thank you,
industries.
thank you.
Excellent job. I'm amazed.
Thank you.
I'm proud of you. Keep up the great work. Keep up the great work. And the interview was, you're a natural.
Thank you,
I heard
thank you,
on the
thank you.
radio
Y'all
all the
hearing
time.
these good
all
raving
the time
reviews?
On the radio. I hear you.
Raving
you're
reviews?
A natural.
Thank
A
you, thank you,
natural at
thank you
this.
so much.
Yes.
But you guys have been watching Islandish Podcast. Continue to stay locked into all the different shows here on Superior Thought Network. Make sure you visit and stop into Rafa Health Center for all of your health needs. And make sure, as always, you be a blessing to someone else in the community. It's been an excellent time. Thank you guys for tuning in. Bye.